The Centers for Disease Control and Prevention says the first patient to be diagnosed with Ebola in the U.S. is being treated in Dallas, Texas.
The bottom line here is that I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country.
The CDC says the patient flew to the U.S. from the West African nation of Liberia on September 19th and began to have symptoms 4 or 5 days later. On September 28th, he was admitted to a hospital in Texas and put into isolation. He then tested positive for Ebola.
So any contact this person had over those 4 days between when they became ill and before they were in isolation, they need to be found, they need to be put in isolation, they need to be monitored for 3 weeks.
Health officials say they are trying to track down any immediate family or people the patient had contact with. Still, they say there is a low risk of the disease spreading, and it's not contagious until someone shows symptoms. Since the patient wasn't sick on the plane to the U.S., health officials don't want people who traveled with him to panic.
We do not believe there is any risk to anyone who was on the flight at that time.
The CDC isn't sure how the patient contracted the disease. As for his condition, they will only say he is ill and under intensive care. In Atlanta, I'm Mary Muller reporting.